Hello everyone, my name is Dr. Lubna and I'm a periodontist, and as you all know, the 12th of May was Gum Health Day. So it's very important to bring awareness to the public, so let's get started. So first of all, it's never normal for your gums to bleed. If you have bleeding gums, it means they are unhealthy. Now the main reason or the main cause for your gums to bleed is what's called plaque. Plaque is a thin film that builds up around your teeth and on your gum lines, and if you don't remove this regularly every day using your toothbrush or flossing, then it will build up, and the first signs of gum inflammation, it would be redness and bleeding. There's some local factors that makes brushing a harder task to do. If you have braces or you have poorly contoured filling that you had years and years ago, then in this case you need to seek professional help where they can guide you through a way that you're able to access areas that you weren't able to access them before. Other local causes is that when you have gum recession, that means when your gum tissue moves away from the tooth and that causes exposure of the root, you will have a abnormal gum margin, which makes some areas very hard to clean, and in this case you need to be referred to a periodontist where you will have these areas treated. Now 99% of the cases, the causative factor is plaque, as we mentioned, and this can be reversed by improving your oral hygiene habits. When you have bleeding gums, especially extensive bleeding gums with other signs, they may be an indicative of a potentially serious illness. For example, patients with underlying medical conditions, as young patients with leukemia, also patients who are hemophilic, which is a blood disorder. Also, there are skin conditions that have an oral manifestation. So some skin conditions as erythema multiforme, lichen planus, or lupus, you will have a manifestation in your mouth called desquamative gingivitis. So there's extensive bleeding and it's really painful. Another cause is hormonal imbalance. So some patients during puberty age, or pregnant women, or a woman on IVF, they may experience more bleeding gums than others. The reason is that with the hormonal imbalance, it affects your immune system and makes your gums more sensitive even with too small amount of bacteria. So the important question is, how can we stop bleeding gums? It's very easy. Number one is that you need to improve your oral hygiene habits, as we said, better brushing and better flossing. Number two, if you're unable to clean better and your bleeding did not stop, then you need to see your dentist and seek professional help. It's very important to see your dentist and your hygienist on a regular basis, twice a year, or depending on what the dentist recommend to yourself, because every patient is different. Also, if you have any advanced problems, then they can refer you to a periodontist. Hopefully that was informative enough, and always remember, say no to bleeding gums and keep your gums healthy.